Hello, good evening and welcome to Joy News Prime. We're coming to you live from our studio here in Kokomlemle, Accra, live on DSTV channel 421 and GoTV channel 125 around the world on myjoyonline.com. My name is Samuel Kojo-Brace.
And I am Faustina Safo. Tonight, Ghana is set to deport over 2,000 undocumented migrants after a major crackdown in Accra with plans to extend the operation nationwide.
Also, Joy News checks reveal several major oil marketing companies haven't adjusted their fuel prices despite forecasts of significant reductions.
And later, when a dream saves, she and her children, Madam Husseina, vowed never to consider suicide as an option in ending what she called a troubled life.
And I didn't also want to leave my boys behind. I didn't want to leave them for anybody. So I wanted to take my life and take theirs too.
Now, the Ghana Immigration Service is cracking down on undocumented immigrants and is collaborating with embassies for swift deportation. Immigration officers are rounding up over 2,000 illegal migrants in the early hours of today at various locations in Accra in an intelligence-led operation which the service say is a bid to rid the streets of beggars.
But first, the following report captures what transpired at the Obechibi Lampe roundabout here in Accra Friday dawn.
Tens of immigration officers sneaked in at dawn on Friday to carry out this operation, a swoop which rounded up hundreds of undocumented immigrants believed to be street beggars. The operation took place at Sabon Zongo, Nima, Aboseokai, and Obechibi Lampe runabout, all in Accra. By 7 a.m., hundreds of these children, women, and the elderly have been assembled here at the Obechibi Lampe runabout, ready for transportation to the immigration headquarters and onward deportation to their countries of origin. Those who spoke to Joy News say they have fled from war to seek refuge in Ghana.
Finding food has become a problem for us. Our husbands and relatives have been killed, and we can no longer stay in our country. We are here only to find something to eat, nothing more.
According to official data from the Ghana Immigration Service, a total of 2,241 immigrants comprising 1,332 children and 909 adults have been rounded up for screening. Here are the views of some Ghanaians on the operation.
And spend the entire day begging for money. They refuse to do any work for themselves. Even our Ghanaian mothers sell water to earn a living. If we were willing to sell water or do any kind of work, we wouldn't have a problem with them. We are truly grateful to the government and the Immigration Service for their efforts.
Immigration, the people, they are guessing about the immigration, but the immigration, they are doing their work. So most of them, what they are doing is not, even we, our people, we don't like it. Because why? One woman have 8 children. He's the one not bonding them. He brought them on the street, they are not school. Even last week, children's home talk about them. They say they want to help them to take the children education. So that then the women, they are going, if you sell ice water, pure water, mango, you sell something on the street, then you help your children. If fees reach, you want to pay, then we help you people to pay the school fees. But these people, we talk to them. I am among the people, I am among the leaders taking about them. If for hospital, anything happening to them, I am among the people helping them. So now, I don't know what they are doing there is very nice because of the children.
For now, it is unclear how long this operation, which is aimed at ridding the streets of foreign nationals involved in begging, will last. and whether it will be extended to other cities across the country. Another question is how long government can sustain this, considering the fact that just 2 years ago, over 1,300 of these foreign nationals were transported back to their countries in a similar operation. Maxwell Aklobotu's report, read to you.
Well, let's hear from the head of public relations at the Immigration Service, Assistant Commissioner of Immigration, Amakun Atta, who reveals that the undocumented immigrants are not only engaged in street begging, but other illegal activities.
Those that are undocumented are engaged in these begging and other criminal activities. Immediately they go to and to the end of their profiling session, buses are ready to convey them to their various destinations. We are in talks again with some of the embassies of these nationals, and they fully support what we are doing. Some of them, a couple of years back, conducted such exercises on their own. So we have their backing, and if any embassy, for that matter, will want to remove their nationals by air or whatever that means, the service is really ready to support such an effort.
Well, in what officials are calling a coordinated national crackdown, the Immigration Service has announced it will launch similar operations in other major cities within the next 24 hours. Well, these areas, authorities say, have seen a sharp rise in undocumented migrants, many of whom live in poor conditions and survive by begging on the streets.
Is to be conducted across the country, especially the major cities. So Accra is the launching pad. Definitely within the next 24 hours or so, the other cities will begin to experience this move of removing these undocumented aliens. Yes, so it's not just going to be confined to the national headquarters, but then outside Accra. We didn't hold brief for anybody who will intentionally do that, but then, and again, it's not an excuse that we always say the borders are porous. But if you look at the measures we put in to ensure that our borders are safe, you realize that we are doing the best across the South region. We're one of the best border security institutions where others even come to benchmark us. Just that at times it's unfortunate that some of our fellow nationals and let me say border residents at times assist some of these people to come in, but then we are in engagement with such border nationals about the dangers of assisting foreigners to enter the country through farm ways and other pathways and all that.
Well, the Immigration Service has given a breakdown of the number of persons arrested, and on your screens now will be the graphical representation of how many people have been arrested. Now, the Immigration Service says it undertook an intelligence-led operation in the early hours of Friday, 16th May 2025, to raid the street of Accra of foreign nationals involved in street begging. The operation seeks to repatriate undocumented foreign nationals humanely and disrupt criminal networks that facilitate their operations in places such as Sabon, Zongo, Nima, Abosokai, and Obichebi roundabout, among others. The arrest made so far has some 2,241 persons involved. So that's the number of people they've picked up so far. If you break it down, it has 909 adults and a whopping 1,332 children. All of these people have been picked up by the immigration. And they say that they are currently being taken through the necessary processes, including security and medical screening at the national headquarters in Accra. The service assures all stakeholders and the general public that the detainees will be handled with the highest professionalism with respect for their human rights. So that's what the Immigration Service is telling us. Now let's bring in Dr. Ishmael Rovo Kwabla, who is an international relations analyst. Doc, I'm grateful to you for joining us. Now, we're in a country where recently the president, has been engaging in several activities or efforts to try to rein in the Sahel countries to still be part of ECOWAS. Will this, exercise by the Immigration Service have any impact whatsoever on that effort?
Good evening and good evening to your viewers. Given the context, this will really have a major impact if it is not properly done.
Okay.
That is to say that if the other countries where these people are coming from, particularly the Sahel states, if they are not involved in the process of trying to get these people deported, then that may create a diplomatic problem. But once these countries, their embassy get involved, from the very beginning to the day they will be deported, and they put in the necessary structures to receive them, we don't expect any challenge to Ghana-Sahel relations.
Okay.
So from where I stand, it is the process you go through, how you go about it, respecting international norms and practices regarding how to treat migrants. So, for instance, collectively deporting them under the pretext that they are all the same will not help. You have to screen them thoroughly and be sure that each one of them may have peculiar needs, and you have to assess all of them on the basis of who they are here. What is the issue? Some of them are coming from countries, particularly the Sahel states, where there are issues of security. There are issues of a place where they cannot actually reside. So on those bases, you may want to exempt those ones from deportation if it is proven that where they are coming from, their lives are threatened. Then you must also look at those who have been smuggled here and those who have been trafficked here, and must be able to deal with them and also collaborate with the authorities at the other end to deal with the root causes of them migrating down here. So if you deal with it collaboratively with them, then you don't have a major challenge from where I stand.
Now, I mean, we've done this before. 2 years ago with the same exercise. And 2 years down the line, we're still here deporting over 2,000 people. What must we do to ensure that we don't have this on our hands again?
So as I said, there are various factors involved in people leaving their home to come and do begging on your street. If they have a very conducive economic and a social environment up there, I'm not sure they are comfortable on the street. So you must begin to deal with some of the root causes and some of the facilitating conditions. So we must collaborate with the Sahel countries to deal with the insecurity there in order to restore security for their people to be safe at home. We must also deal with criminal networks that are taking advantage of the situation to smuggle them here. So there are people among the Ghanaian population that are benefiting from this. If we don't deal with those people, we may deport them, and then a few years down the line, they are back. And also, maybe we have to improve our border governance and migration governance regime to be able to address some of these challenges. So without dealing with the source condition, the condition at the source that will lure these young ones and their mothers and fathers to this place, this challenge will not be resolved.
I'm grateful to you, Doc, for joining us.
Well, let's shift our attention now to the health sector. The Ghana Health Service has intensified efforts to contain mpox after confirming 2 cases in Accra. Regional health directors have been urged to reactivate emergency operation centers. Now, in a statement signed by the Ghana Health Service Director General, Dr. Samuel Kaba, the public is advised to adhere to social distancing protocols and remain vigilant as contact tracing is underway to prevent further transmission. Well, the director of the Ghana Infectious Disease Center, Dr. Oliver Kome, has been explaining the measures and safety procedures Ghanaians should adhere to avoid the spread.
So once we have 1 case of mpox, we say that there is an outbreak. So then yesterday, the National Public Health Emergency Committee met, and the regions have also been activated. All teaching hospitals have activated their centers. So it's not just one place, but across the country.
How infectious is this disease?
It's contagious in the sense that if you come into contact with the infected person's pox material or bedding, so you must have close contact with the person, with an infected person, before you will have mpox.
Okay, and these 2 persons, what's their status as we speak?
So most of the 2 we have are all stable. They are currently self-isolating at home. So they tend to have a sore throat, and then they tend to have a rash in the genitalia.
So which means that beyond or before the rush, it presents itself as other diseases, would it be? Do people confuse it with malaria or any other illness?
Yes, so all the two we had managed themselves over the counter with malaria tablets. Until the pox broke out, they weren't going to go to hospital.
Well, let me bring in Dr. Louisa Mateshe. She is the public health physician specialist at the Accra Metropolitan Directorate of the Health Service. We appreciate your time here on Joy News From. I just want to get a sense of efforts underway to ensure that we contain the spread of this virus.
Thank you very much and good evening to your listeners. Yes, so since yesterday, we appreciate that the information has gotten out into the public. And since then, we've held series of meetings and series of trainings. As a matter of fact, once these things come out, we need to make sure that some key teams are out there. And core amongst them is the Public Health Emergency Management Committee at the districts level. And I heard you say something about the region and all that. And then also the rapid response team that look at the technical teams that have to manage this disease. Clinicians, doctors, nurses, disease control officers, public health nurses, and our community health nurses who are so close to our communities and visit homes to assess the state of people's homes, visit contacts, follow them up, and then bring back information on how the community is handling these things as well. So in the past 24 hours, we've been frankly very busy making sure that our rapid response teams are up and doing, sensitizations are ongoing. We are gathering our logistics and making sure that our facilities are well equipped to make sure that anytime there's any such case in the facility, we are ready to handle it. Healthcare workers don't get unnecessarily exposed so that we have infections amongst healthcare workers, and of course, making sure that the community work is also being done. So we are.
So for now, we just have 2 confirmed cases.
Yes, please.
And for people watching, they're wondering what they can do to keep safe in this period. Can you advise us what exactly should we be looking out for?
Yes, Mpox is very much a viral disease, close to how COVID-19 behaves in quote. And if you remember, in 2020, we were talking about things of contact. Remember mentioning, don't get too close to people because it's very similar. Mpox is a contact transmission. So once you get too close to people who are either having the prodromal states, which is what you were asking about, whether it looks like malaria, people have fever, and then they are not feeling well, and that sort of thing. You're not too sure what's going on. And then later the rash comes. So, even in the prodromal states, people can still be infectious. So as much as possible, we are saying that if you're not feeling well, don't guess. In this state, don't say that every fever you feel is a malaria. So seek help promptly so that we can get to the bottom of what's happening, so that once we get that this is the infectious disease, you save a lot of people and you don't get into contact with so many people and then get others infected. We can wear our face masks when you're going into the crowded areas. The hand washing that we used to do in COVID, let's go back to it. Let's avoid shaking hands with people as much as possible. Observe our cough etiquette. I remember we were told, don't cough into your hands. Use your elbow so that just in case you forget yourself and shake somebody's hand, you are not transmitting viruses. The preventive measures are really very simple, everyday life things. And these things we used to do during the COVID era. And I think people should remember to go back to them.
We appreciate your time here, Doc.
Well, away from that, nearly 2 months after the Food and Drugs Authority ordered a recall over safety concerns, the banned Grand Chateau Sangria Fort is still being sold. Johnny's checks revealed pubs, bars, and even provision shops continue to stock the unregistered drink. Johnny's Mamavi Sefakote has more in this report.
Despite a recall and safety warning from the Food and Drugs Authority, Grand Chote Sangria Fort remains widely available in shops and pubs across Accra. The FDA had ordered a market withdrawal in March, citing violation of the Public Health Act due to lack of registration. The product's packaging, resembling children's juice boxes, poses a risk of accidental alcohol consumption, particularly among children. However, sellers say the shortage of top beer brands has driven demand for sangria as an alternative.
Anyway, but and Sanitation, like a club say, we are not getting it. We are not getting it at all. It's been, difficult for us to get beer. No, if Accra Brewery, they don't bring us the drink. I was here a baby. Now and the price is gone high. Shangrand and Crofoto. Mankas or Monto, they buy it. They buy it a lot. That one and then the coffee rum, it moves. Not maybe war. Maybe war story. I did a movie for that one day. A cock, and the Mancas a cock.
If say March and I'm a coffee no man. Na May $30 so. Are you expecting me to sell it March May price? Any juma March and I'm a cotton. Sa price and I was saying to say the bear means to miss it any day.
The FDA promised a stricter enforcement in its recall statement, but the continued presence of sangria on the market points to a worrying gap in the compliance and regulatory oversight.
The FDA's promise of stricter enforcement has yet to be seen, highlighting concerns over regulatory compliance.
Now, still staying with the FDA, it says it is set to crack down on the illegal importation and sale of illicit drugs in the Ashanti region. Regional Director John Layode Tete says the authority, in collaboration with other agencies, will launch street operations targeting tramadol, red, and other opioids. Speaking at an anti-opioid forum in Kumasi, he said the move aims to curb abuse and preserve the drugs for legitimate medical use.
Currently, the lower strengths like 50 and 100 milligram strengths are registered, and specific brands are also registered. So those that are above 100 milligrams are not supposed to come in. And that is what we are doing together with the relevant agencies. The law prescribes the sanctions, and most of those arrested have been arraigned before court. So we are on it. The laws are working, and we want to prompt and advise all those who are misusing these kinds of medicines to stay away from it. The illegal importation must also be watched. And as we are collaborating with the relevant agencies, we'll clamp down and be aware that we will come after you if you are dealing in this kind of medicines.
Well, from that, despite projections of significant fuel price reductions, many oil marketing companies have yet to adjust their pump prices. Checks at major fuel stations show retail prices remain largely unchanged, contradicting expectations of a major price drop, which would mark the 6th consecutive decrease since March. There's more in this report.
Fuel prices were expected to drop on Friday, May 16th, with petrol prices potentially falling by 6.7 to 8.8% to around 13.27 Ghana cedis per litre, diesel by 4 to 6% to about 14.40 Ghana cedis per litre, and LPG by 5.3% to approximately 16 Ghana cedis per kilogram. However, checks at major fuel stations show prices remain unchanged, contradicting expectations.
Yesterday I bought it, but yesterday really and truly I couldn't work the way, so it left small and I continued this morning. So I've now bought this one, so let me see at the end of the day. I think it will be good.
Here the supervisor tells us that they've not reduced the prices yet.
I've noticed it now.
Drivers are excited about the expected fuel price reduction.
You see, if the fuel price is coming down, we are all happy about it. For if the fuel price is going up, you see, the country makes something. So if the the thing come down, wow, everybody make happy about it. So if everybody can move with the cars.
We feel very happy because it's also help us in terms of the economy.
Officials from top brands like Shell, Total, and Ally Oil confirmed off record that prices remain unchanged without providing clear reasons for the delay. A full attendant at Glory Oil confirmed there is no price reduction at his station.
Within this week, it has gotten down and we are selling it at 13.45. Okay. 13.45, yeah.
And how about the diesel?
The diesel, it was 15.05, but this week we are selling it at 14.4.
How about the reduction? Today we are expecting a new price coming down.
We did not hear any updates about it.
Have you heard about the possible reduction in prices?
Not really.
You haven't?
Yes.
Some oil companies like Star Oil and Go have adjusted their prices. Go now sells Super SP at 13.22 Ghana cedis and Diesel SP at 13.91 Ghana cedis, reflecting a price drop.
Yeah, I experienced it. Yesterday, I bought it around from Star Oil. It was 12.79. This morning, I realized that it has reduced to 12.47 or so.
With Star Oil too, they've reduced it.
So you are feeling the impact?
Yeah, I can say I have. I'm yet to.
Reporting for Joy News, Collins Frimpong.
Well, let's bring in Duncan Amwa, who is with the Chamber of Petroleum Consumers, COPEC. Duncan, I'm grateful to you for joining. Is it worrying that most OMCs are here to reduce their prices?
Well, it is quite, it's unfortunate, not surprising though, because that's been the trend for some time now. Anytime you get the indication fuel prices are likely to go up, you will get quite a good number of oil marketing companies increase pump prices effective the first day of the window. Anytime the reverse is the case where you're supposed to see some adjustment downward, then the delay sort of thing comes to play where people are not exactly in a hurry to give the consumer the reduction that is due them. And so I'm not surprised that indeed at this time only 3 oil marketing companies have so far indicated a downward review of their prevailing prices as of yesterday. But this is one of the things that we think give some bad faith to the Ghanaian consumer.
Okay.
When it has to go up, they adjust upwards. When it has to come down, then you would have to pay a little more on the first day and sometimes the second day. If you are lucky, the third day, some would then come with new prices. I don't think this is fair, but it's not surprising either.
Okay. And if that should not continue, what measures should be taken to stop this?
I would, as I have always suggested, for the consumer to be price sensitive, we, together with your outlets, the media, of course, provided timely information on, price movements, where we expect fuel prices to be within a day or two. The Chamber oil marketing companies have equally joined and are now able to provide all of us price updates. And so when prices are supposed to decline, and then you have OMCs who decide that, we still need to sell to you at old rates much higher than you should be paying for as of now, then it should be imperative on the consumer to ensure that they avoid some of these OMCs that would simply not want to give them the lower prices that the market dictates. So from tomorrow, if you can, avoid some of the OMCs who are clearly sleeping on their jobs. They are supposed to have submitted their indicative prices to the NPA by the 14th of the month. 15th, 16th, if you cannot still be able to come out with your prices, then clearly there is a problem.
Okay.
And I don't think that they don't have the capacity to roll out new prices. There's just a wait-and-see attitude that allows them to still collect more. It's unfortunate. We are not happy about this situation.
Okay, all right. Duncan, I'm grateful to you for speaking to us here. This is still Joy News Prime on the Joy News channel. We'll take a break here. We'll be back with more. Please do stay.
Well, thanks for staying with us. Now to other stories. The University of Ghana has been named the biggest offender in salary overstatement. Well, that's according to the Auditor General's latest payroll verification audit of 86 million Ghana cedis saved from the inflated claims across the ministries, departments and agencies. The university alone accounted for 59.2 million Ghana cedis. That's over 68% of the total savings. Well, the discrepancies mostly occurred between the year 2022 and 2024, with a sharp spike in the year 2024 election year. The audit also reveals that overall, just 32.6% of the flag 38.9 billion Ghana cedis has been recovered so far. Well, joining us now for more on this is Deputy Director of International Audit at the University of Ghana, Professor Samuel Simpson. Thank you so much for your time here on Joy News Prime. Prof, we've just been seeing the Auditor General's report, and it says that the University of Ghana alone accounted for over 68% of all payroll savings flagged nationwide. I'm wondering, how does the university actually explain such a significant overstatement?
All right, good evening. I must say that the analysis done by multimedia Joy News certainly misleading.
Why?
If you are drawing on auditors' reports, it's important that you understand the context and the facts behind the figures, especially where again you have decided to project University of Ghana as, let me say, a West corporate.
It's not us trying to project the University of Ghana that way. Just explain to me why you feel that we did not project it rightly, because that's what the Auditor General's report says, except if you have documents to prove otherwise, or you want to break it down to us differently?
You know, whenever you are undertaking research and you are drawing on secondary data, once you start getting outliers like this, the next thing you do as researcher will be to contact the source of the information so you can appreciate the context. University management will be issuing a response to that. But let me just give you just a quick highlight. When it comes to payroll, University of Ghana will send the data to GTech. GTech indeed will in turn give the report to audit service for them to audit before numbers are finalized. In line with the PFM Act, what University of Ghana usually does will be to show to GTech how much we expect the government of Ghana to pay based on the clearance that they are giving to University of Ghana. But you will agree with me that the lecturer to student ratio is not something that we can talk about.
I want you to be definite with me. Are you disputing claims that the university overstated the payroll? Is that what you're saying?
But it is misleading. That is not the case. That is not the case.
What is the case?
University of Ghana is actually not overstating any figure. That is what I'm trying to explain.
So the Auditor General lied? Is that the case?
No, listen to me. Listen to me. I'm not saying that. What I'm saying is that what University of Ghana usually do would be to state what the University of Ghana is getting from government of Ghana. Then we also indicate how much we are generating internally to support what the government is supposed to have paid. Let's say, for example, we need 5 staff to deliver our service. Government has given us clearance for 3, and government is willing to pay for 3. As a serious university willing to support government, University of Ghana then decide to use the IGF to pay for the other 2, so we can deliver our service. So, of course, with the accounting and the calculation, it is possible that this IGF is what has been reported as being savings. That is misleading. And as I indicated, the researcher...
don't know that before the Auditor General comes out with that report, it gives the institutions like yourself that opportunity to answer. Did you provide this explanation to the Auditor General before they came out with this report that we referred to?
I must say that with this special audit, no management letter was issued, and this got nothing to do with the normal audit. This one is not a normal audit. They refer to that as what? Special audits. Every normal audit or regular audit, what happens is that management letters are issued and we respond. This has nothing to do with that. This has nothing to do with that.
All right. So do you mind? Is the university willing to take on the Auditor General for this? Because they said they put those figures out.
Well, as I indicated, university management will be issuing a statement very soon. And as I said, what multimedia did by way of the analysis is extremely
I'm not sure it is us. We're only referring to a report, but we're grateful to you for joining us here. Away from that particular story, President John Dramani Mahama has announced plans to decentralize Ghana's sanitation budget, making a district responsible for their own cleanliness. This move aims to address inefficiencies in the current system, which is criticized for channeling large sums to private companies that end up exploiting their workers. Speaking during this thank you tour of the Greater Accra region, President Mahama says sanitation will now become a key performance indicator for assessing local assemblies.
More resources are going to be available to all assemblies to implement their development projects and carry out effective sanitation programs to keep our districts clean. Cabinet will soon meet on a decentralization of the sanitation budget and make every district responsible for its own sanitation. Cleanliness will become one of the key performance indicators for measuring the performance of MMDCs and will determine whether they remain in office or are removed. Now that most of our DCEs have been nominated and confirmed, we'll begin observing the National Sanitation Day program every month. This will be a revived monthly exercise involving all Ghanaians. This time, it will not be a symbolic event. It will be legally backed, it will be properly funded, and it will be operationalized through partnerships with local assemblies.
Well, President Mahama also revealed that Vice President Professor Nana Jane Opoku-Agyeman has fully recovered and is expected back in Ghana before the end of next week. She is set to resume official duties upon her return.
I begin by bringing you greetings from Her Excellency, the Vice President of the Republic of Ghana, Jane Nana Opoku-Agyeman. And I'm happy to state that I spoke to her yesterday morning, and she'll be back in the country before the end of next week. By God's grace, she's fully recovered, and she's going to come and go back to her duties.
In a lighter moment during the tour, the president drew laughter when he joked about gifting a dancer 500 cedis, not dollars, in appreciation of her impressive performance.
They gave us. And to put on record that the money that I gave was 500 CDs, not dollars. Thank you.
All away from that, the Bono Regional Minister Joseph Adai Akwaba has underscored the importance of empowering community health nurses to achieve universal health coverage, speaking at the National Delegate Conference of Community Health Nurses in Sunyani. Mr. Kwaba assured of government's commitment to address concerns, including professional development and fair remuneration through reforms in the reset agenda for effective healthcare delivery. There's more in this report by Precious Semevo.
Members of the Community Health Nurses Association are noted as the backbone of Ghana's primary healthcare service delivery, as their services are often at the doorsteps of people in rural and underserved communities. At a two-day delegates conference at Sunyani Esufufu in the Bono region, the outgoing president of the association, Esther Frimpoma Bamfo, stressed the risk they take to make health service delivery available, accessible and affordable in all hinterlands with or without logistics, yet the least is said about them. She called on the government to offer them incentives and honor promises.
The 20% of whatever the government should stick to his promise and provide it. Again, provide them decent accommodation to live in and work. Again, they should provide them with incentives. Incentive not only about money, but encourage them. Some of the leaders that we are working, the stakeholders, sometimes the kind of words that will come from my mouth to the community of nurses. And lastly, government should recognize community of nurses and give them scholarships so that they can also continue to further their education.
Regional Deputy Director of Public Health, Dr. Prince Kwashi, acknowledged the impact of community health nurses in achieving universal health coverage and the need to promote their welfare.
Suppose we, as a service, strengthen the role of community health nurses, Ghana can achieve UAC goals. To our community health nurses, your resilience inspires us. We urge communities, traditional and opinion leaders, and policymakers to join hands to safeguard your welfare in the communities you work in. I urge you to report challenges, demand accountability, and champion your rights.
Bono Regional Minister Joseph Adaya Kwabwa assured of the government's commitment to empowering and addressing their concerns as part of the reset agenda.
Issues of professional development, fair remuneration, logistics, and safe working environments are crucial. It is important to note that achieving universal health coverage is not a dream. It is a goal that is within reach if we empower our health workforce. And empowering our health workforce means supporting our community health nurses, varying their contributions, and providing them with the required resources and recognition they deserve. Let us remain patient with the government.
Francis Botwe was elected the association's president for 4 years at the conference themed Welfare and Contribution of the Community Health Nurse in the CHIPS in Achieving Quality Universal Health Coverage. Precious Semevo, Joy News, Sunyani.
Away from that, former member of parliament for Ashanti Central, Kennedy Ejapon, says with the bright start of Ghana after independence, the country would have been in the league of first world countries, but for visionless leaders. He maintains the country will continue to grapple with unemployment, economic, among other challenges if bold and decisive actions are not taken to change course. Speaking at the Youthquake Conference at Central University at Miocho in the Ningo Pram district, he shared his desire to lead the country. There's more in the following report.
The Youthquake Conference, which was on the theme Entrepreneurship and National Leadership, brought together students from Pram Senior High School, Central University, and politicians. Former MP for Ashanti Central, Kennedy Ejapon, who was the keynote speaker, blamed Ghana's leaders post-independence for the country's stagnation, despite abundant natural and human resources. Touching on the qualities of a leader, he says a visionary leader with courage can turn around the high unemployment situation in the country.
I stand here as a Ghanaian, and on top of my head, I can tell you the challenge Ghanaians are facing, especially the youth of this country. When we have over 100,000 students coming out of every year, you have only 10% getting jobs. What happens to the 90%? You need a leader who is creative, A leader who is bold and courageous to say that, look, enough is enough. Let us change the status quo and change the narrative. If we do that, Ghana will see the glory during the independence time again.
Having taken a shot at the new Patriotic Party's flag bearership in 2023, Ken Ejapon believes he has what it takes to give the country a clear sense of direction.
And I have a vision, I have a dream. As a businessman, as an entrepreneur, young men and women here, vote for me to come to power, and you see how I'll use businesses to change this country.
Well, today in our series celebrating motherhood, we bring you the story of Louisa Mateshe, a mother of 3 who faced heartbreak and hardship after a painful separation from her husband, forced to take on multiple jobs to provide for her children. The pressure once pushed her to the edge, leading to a suicide attempt. But through the darkness, her love for her children gave her strength to keep going. Hannah Adami shares her courageous journey of survival, resilience, and the unbreakable bond of motherhood in the following report.
After a painful separation from her husband, Hensema Donko found herself in a difficult situation. With 3 young boys to cater for, she knew she had to take action to avoid a disruption in the development and growth of her children.
I sell shirts and I do piano tuition for beginners.
Seeing the yields of her hard work through the success of her children, especially at school, Madame Hensema took on more tasks as the bills increased, learning to braid hair to add extra notes in her purse. For her, each braid was a new opportunity, just like each day. The vigor in providing for the family takes her out of the home at dawn and brings her back after dusk. The strain on her once made her to think of ending it all through suicide.
I wanted to kill myself. What I was going through and that moment, I said, why? What is happening? What have I done? So as I was thinking about it, how I should do it, and I didn't also want to leave my boys behind. I didn't want to leave them for anybody. So I wanted to take my life and take theirs too. And if I take it first, they can't go. So I have to give them medicine. And then when I finish, then I'll also take mine. So I was just planning. The moment I slept, I dreamt. I dreamt that I had given medicine to them, the boys, my boys too. I've given medicine to them, and when they were dying, they were struggling. So I said, wow, this is what they are going to go through. No, I can't do that. Then I heard a voice in the dream that I have plans for your life. I'm going to use you to bless many nations. What you are going through, you have to go through. So just keep quiet. I am with you. Don't. The moment that voice, and then I was awake. I sighed. So God, you are with me. And so but I can say by grace, I am alive. And what God said to me when the time I wanted to take my life, I see that it is happening. So I see that I am not there yet, but gradually God is doing what He has promised. And I believe in Him. I trust in Him that we will surely get there.
Today, Hensema is a beacon of hope, reminding others that even in the darkest moments, there is always a way forward. Her children, who are so proud of her, captures it best.
She cares for us. She does a lot of different jobs, different things just to cater for us.
I love my mother very much because she's a kind and gentle woman. She does her best to provide for us, and we love her very much. She shouldn't worry, and we will make her proud. Thank you, Mommy. We love you very much.
My mommy is a God-fearing woman. She always teaches us how to read the scriptures and pray, and I appreciate what she has done for me.
For Madame Hensema, every day is a new challenge. She also has her own dream, one she holds dearly, but wants to ensure her children fulfill theirs first.
I want to become a superstar, a gospel superstar. That's what I want to become.
Madame Hensema wants other women navigating life's challenges to remember they are not alone.
Never ever dream of killing yourself. God has a plan for your life. God has a lot for you. You will die before you realize, this is what God has for me. Never ever dream of killing yourself. Just do something, Do something. Just don't sit down. That one, don't sit idle. Do something. Find something for yourself and do. Take good care of yourself. Take good care of your children. Don't curse your son. Don't curse your daughter. Don't curse. Never. And words are spirit. Words are powerful. Words are life. Never do that to your child. Just when you wake up, bless your children. And God will come in at the right time. God will supply all your needs. God bless you.
For Joy News, I am Hannah Odami.
Touching story there, Kojo.
What a story.
What? But I think we trivialize mental health in the country. Sometimes when you're listening to voices in your head, seek help.
Yes.
Talk to somebody. Get the help you need.
And her story also talks about what you don't know lies ahead of you. If she had killed herself, her children wouldn't have gotten to it, and they now want to make her proud. So it is the fact that suicide is never an option.
Indeed, it is.
What a story to really commemorate Mother's Day with. This has been Joy News Prime. There is more on myjoyonline.com. Please do have a wonderful weekend, but prosperous. I think we're done with Mother's Day, right?
Yes, we are.
We were done.
But we have to celebrate mothers the whole month.
Yeah.
And that's why we're doing this series.
I owe you dinner today for the story.
See, that's okay.
Right,
okay, that's how we wrap up the bulletin. Bye.
Bye. Kojo Baka is up next with Prime Business.